Hello everyone, welcome to Community Medicine Insight. Today we will discuss questions which are related to Anemia Mukt Bharat program. So first question is, what is the target reduction in anemia under Anemia Mukt Bharat program? And the different options we have 1%, 2%, 3% or 5%. So here the correct answer is 3% per year. So this program was launched in the year 2018 with an aim to reduce the prevalence of anemia by 3 percentage point per year among the children, adolescent and women of reproductive age group. What is the full form of 6 by 6 by 6 strategy in the Anemia Mukt Bharat? The options we have are, so here the correct answer is option B. 6 target group, 6 interventions and 6 institutional mechanisms. Which one of the following is not one of the interventions under the Anemia Mukt Bharat? These are the different options, that is prophylactic IFA supplementation, deworming, blood transfusion for all the anemia cases or the behavior change communication. So here the correct answer is transfusion for all anemia cases. So we have read in the previous slide that there are 6 interventions. Among 6 intervention, first is your IFA supplementation, second is deworming, behavior change communication is also a component. Next is testing and treatment of anemia. So in treatment of anemia, blood transfusion is not recommended for all the cases. It is recommended only for the severe cases of anemia. Then fifth is your food fortification. And 6 is addressing the non-nutritional causes of anemia. Which of the following group is not a target beneficiary under Anemia Mukt Bharat? And different options we have are children, adolescent boys and girls, elderly and pregnant women. So here the correct answer is elderly population. So the 6 beneficiary which we have read under the Anemia Mukt Bharat include the children 6 months to 59 months. Then we have adolescent boys and girls, pregnant women, lactating women, then women of reproductive age, and 6 is children from 5 to 9 years of age. Elderly may have anemia, but they are not included in the Anemia Mukt Bharat framework. Next question is, an institutional mechanism in Anemia Mukt Bharat primarily includes, the option we have is health sector only implementation, limited interministerial coordination or multi-sectoral convergence with monitoring, and the tertiary care focused approach. So here the correct answer is C, multi-sectoral convergence with monitoring. As anemia is of multifactorial origin, there is convergence with different departments, and the 6 institutional mechanisms include intra-ministerial coordination, then second is interministerial coordination, and we have a Anemia Mukt Bharat unit, which is a dedicated unit which is responsible for overall program management and the strategy oversight. Then fourth intervention is National Center of Excellence and Advanced Research on Anemia Control, that is located in AIIMS, Delhi. fifth is the strengthening of supply chain and logistic. And then sixth intervention is Anemia Mukt Bharat dashboard and digital portal. Which ministry is the nodal ministry for the implementation of Anemia Mukt Bharat? And different options here are Ministry of Women and Child Development, Ministry of Health and Family Welfare, Ministry of Education, or the Ministry of Rural Development. Correct answer is Ministry of Health and Family Welfare. What is the composition of IFA tablet given to pregnant women under Anemia Mukt Bharat? And these are the different combinations for elemental iron and folic acid. Earlier we were giving 100 milligram elemental iron in the government program, but now the current recommendations include 60 milligram of elemental iron. So under the program there are different color tablet. The red color tablet, which is given to the pregnant and lactating women, it contains 60 milligram of elemental plus 500 microgram of folic acid. Blue color tablet, which is given to the adolescent, and in that also the composition is same, that is 60 milligram elemental iron plus 500 microgram folic acid. And there is pink tablet, which is given in the children age 5 to 9 years. In that the composition is 45 milligram elemental iron plus 400 microgram of folic acid. What is the main purpose of behavior change communication in Anemia Mukt Bharat? Different options include to distribute iron tablet, to improve the diet and ensure people taking iron tablets regularly, to treat severe anemia in hospital, and to replace the deworming and iron tablets. So here the correct answer is option B. In behavior change communication strategy under the Anemia Mukt Bharat, it is designed to basically change the habits of the people. This campaign focuses on four key behavior. First is improving the compliance of IFA tablets and deworming as well. So it has been seen that even after giving the IFA tablets, the people are not consuming it, or when in campaigns the deworming tablet is being given, people are throwing it away. Therefore, people are being encouraged to have regular consumption of prescribed IFA tablets and adherence to biannual deworming schedule to combat anemia. Second is optimal infant and young child feeding. In this, the government is promoting exclusive breastfeeding and age appropriate complementary feeding. Third is diversification of diet and food fortification. Next is delaying the cord clamping. What is the recommended prophylactic doses of IFA tablets during pregnancy? And these are the different options. Here the correct answer is 1 tablet daily, that is option B. 1 weekly tablet is given in the case of adolescent under the WIFS program, and 2 tablets are given if the female is anemic. Here the question is asking about the prophylactic dose. So here the answer is 1 tablet daily. From which trimester is IFA supplementation started in pregnancy? Here the correct answer is second trimester. IFA supplementation in the pregnancy is started from second trimester and it is given 180 days during pregnancy and 180 days postpartum. that is after the pregnancy. In first trimester, we are giving only folic acid and not iron. Which test is commonly used at the field level for anemia screening under Anemia Mukt Bharat? Different options we have include ELISA, Sally's method, digital hemoglobinometers, and PCR. So here the correct answer is digital hemoglobinometer. Portable, quick, and they are more accurate when compared with the Sally's method.